Hello, everyone. This is Jessica Malaty Rivera taking over the Vaccinate Your Family handle for today's live. I am really excited to be here. I'm going to wait for some folks to come in. And then we're going to invite our special guest, Dr. John Brownstein, where he's going to be sharing some exciting news about Vaccine Finder, and we'll answer some common questions that we have seen in our requests. Okay, we're just waiting for him to connect. Hi, John.
Hi, how you doing?
Good. How are you?
Good to see you.
Good to see you too. Couldn't think of a better partner to do this with on World Immunization Week, and excited too because it seems like there's some really cool news coming from your end at Vaccine Finder. I thought maybe you could kick us off with the latest and we can chat about that and then answer some common questions.
Yeah, so great. Awesome to be here. So my team has been working on a tool to help people find vaccines in the community for many years, a website called vaccinefinder.org in partnership with CDC and my organization, Boston Children's Hospital. And over the pandemic, we've been building a tool to support helping people how to find COVID vaccines. Obviously, really challenging technology and websites that are really slowing people down in finding appointments. So vaccinefinder.org is a navigation tool. It brings together all the resources out there that the sites that are providing vaccine into one website that is federally supported. And what's really exciting now is that we've now moved over to Vaccines.gov. So if you go to Vaccines.gov, you will see the site. It's got a lot of improvements. We now do Spanish language translation. We now have many more sites, about 3 times the number of sites that we once did. We have improved accessibility. There's just going to be many ways for people to be able to access information, eventually call center and text messaging. So lots of different opportunities for people to be able to finally get information about vaccines in the community. So, right now we recognize that we're hitting a bit of a wall in terms of the pace of vaccination. And part of that is driven by access and just the challenges people have to take the time to get the vaccine for whatever reason. So we're trying to bring those barriers down, trying to meet people where they are with the tools that they want to use to find out where to get the vaccine. So super excited about that.
That's awesome. So for those of you who have just joined us, Dr. John Brownstein, infectious disease epidemiologist, has just announced that you can now go to vaccines.gov to find vaccine appointments across the US, and it is multilingual and has a number of tools to make accessibility to appointments really easy. John, can you tell us some of the biggest barriers that you have found for people to make appointments, and how has Vaccine Finder, vaccines.gov, solved those?
Yeah, absolutely. So, clearly there are just a lot of challenges in state level websites. Maybe there's no good state's website, or the state websites themselves have been bogged down or overrun. People just don't fully know where there is vaccine around them. Surprisingly, it's not that simple to know that, what local pharmacies have something in stock. What Vaccine Finder does is actually provides availability of in-stock information for pharmacies, clinics, whatever it is, all into one spot. So it's the idea is that you put in your zip code, figure out what's near you, and then it's a jumping off point to either booking an appointment, or really right now, just showing up, because there's just so much walk-in availability in vaccines. Yeah. And so it's oftentimes not even needed to make an appointment, just because there's so much supply out there. So cutting down the amount of time, bringing awareness to where you can go, and then also giving choice. Clearly people may have different reasons for selecting different vaccines, the 3 that are available, and we have an ability for you to select the one that you're looking for.
Yes, so that actually brings me to my point. Can you, when you are looking for an appointment, do you automatically select which manufacturer you're looking for, or is it you have to go to a pharmacy first and then select? Can you walk through the process of how you do it?
Yeah, so essentially you can select right out of the gate. You put in your zip code and then put which vaccines that you're looking for between Pfizer, Moderna, and the Janssen J&J vaccine. You select which ones, and then it will tell you for those sites that it pops up on the map which ones are in stock and which ones are out of stock. So if you have a particular preference, obviously there's reasons why people may select an mRNA vaccine, or they may select the one-shot J&J for good reason. So this gives people choice. We did not have that kind of choice at the beginning of the pandemic. Right. I was, for one, just happy to get whatever was offered to me. But now, at this moment, there's choice and people can make decisions on what they prefer.
Yeah. Are you noticing that there are places that don't have as many vaccine appointments available, or just not as much supply? Or do you feel like there's been a pretty good equitable distribution of doses right now?
Well, that's a really good question, because our team is spending a lot of time thinking about this concept of vaccine deserts. We've done a large scale analysis, and there are tens of millions of people that don't live in a great location for vaccine access. They have to drive 30 minutes to get to a spot. Unfortunately, the patterns of vaccine deserts line up with a lot of the health inequities that we've seen across this pandemic, whether it was access to testing, the outcomes related to the pandemic. So in this case, yes, unfortunately, some of the access issues fall against ethnic racial lines, they fall against economic lines. And so this is why it's so important to fill in those gaps. We are working to figure out, with the analyses that we're doing, how do you where do you add mobile sites? How do you fill in the gaps? And I know the work that you've been talking about with Uber is a part of that, right? Because giving people a lift, making it convenient, reducing that barrier of transportation is one big step in trying to get people immunized. It's not about necessarily massive amount of hesitancy out there. It's about just the challenges of just, getting people the resources they need to get the vaccine.
Yeah. And I know that the Biden administration had prioritized, possibly having access to appointments within 5 miles of everyone in the US, which seems like a very lofty goal, just considering some people literally live 5 miles from anything, or at least 5 miles from that. So how do you feel like we're doing on that front? Are you noticing that there are more sites that are opening up, or what are you seeing there?
Well, interestingly, for that stat, that's actually a stat that my team worked on, this statement about 90% Americans within 5 miles. And the truth of the matter is that is correct. So almost, all Americans are proximal. Now, being 5 miles doesn't necessarily mean that it's still easy if you don't have a ride or can't get an appointment. So there are other barriers other than just pure geography to consider. But, as we see this supply ramping up, as we see more sites come online, and more targeted outreach, I think, yes, it's becoming easier and easier for most Americans to get it. And now with that rush of demand that's sort of out of the way, it's even more simple, because you can do these walk-ins, or you have more choice available to you.
Okay, great. I have 2 more logistical questions about appointment making. So one, do you have to have insurance? Because I know that sometimes when you're creating a appointment online, or even through the websites, you'll be prompted to do that. Do you need to be a citizen, and do you need to have insurance?
No, neither of those things are required. You do not need an insurance. The Biden administration has made sure that the vaccine is available to everyone, regardless of their health insurance status. And you do not have to have citizenship either. I think this has been super important from an equity perspective, that you do not need to provide any level of detail about your immigration status or your health insurance status in order to get vaccinated. We are seeing a major drive to get everyone access regardless of their situation.
Awesome. And even on the website, there's no need to fill in those.
No.
Okay, perfect. And then last question on the logistics of the website. I've had a number of people ask me about moving in the middle of the pandemic, moving in between doses, being in 2 different jurisdictions for dose 1 and dose 2. Does that matter? What can they do to make sure that they're fully vaccinated within the appropriate window of time? Yeah,
this is a really good question. This is part of this issue that we've been talking about quite a bit over the last several weeks, about missed second doses. There's a recent number put out by the CDC about 5 million missed second doses. I think part of those are potentially people that have just traveled to other states, and maybe the data hasn't quite been integrated. You should not let a move get in the way of getting the second dose. There is plenty of supply out there, and if you happen to get vaccine at a mass vaccination site and then you moved, get that second vaccine at a Walgreens or CVS, that is absolutely fine. There's this recommended timing of 3 to 4 weeks from Moderna and Pfizer. There's a real recommendation that you try to stay within 42 days as much as possible. And even beyond that, it's still preferable. So even if you're outside of that 42 days, absolutely still worth getting that second dose. If life got in the way, or the challenges about booking appointments, just meant that you had to delay, it's still okay to get on board and get that second dose, even if you're outside of that time period.
Okay, awesome. So for those who have just joined us, just a little recap, we are now seeing that Vaccine Finder can be available at Vaccines.gov. You don't have to have insurance. You don't have to have U.S. citizenship to have access to these vaccines. We're excited to announce that 90% of people in the U.S. are within 5 miles of a vaccination center, but there are still, as we mentioned earlier, a lot of barriers to vaccination, which is why on World Immunization Week, we are very kind of committed to amplifying these needs and making sure that we can all be part of solving these problems to make sure that everybody has fair and equal access to the vaccines. John, I want to talk about some of the kind of common questions that you and I get night and day via Instagram, Twitter, etc. And one question that has come up a lot is that now that Johnson & Johnson is unpaused, and now that it's back available, you can select it on vaccines.gov. Have you noticed any kind of changes in demand for that? And how have you noticed, what are you telling folks when they are kind of reluctant to pursue that vaccine?
Yeah, it's a really good question. So we've been tracking sort of hesitancy around all the vaccines since they've been authorized. Specifically with J&J, not surprisingly, we saw hesitancy increase with the pause. People had some concerns, obviously, with some unknowns. It's understandable. Now, what I really try to reflect to people is that this pause was not because the vaccine was unsafe. It's because there was a signal that was generated in data, and to be completely transparent and take these events seriously, and because it may, there may have been more cases because it affects treatments of certain subpopulations, that there was a decision to pause and review the data, and ultimately did not find sort of a large number of cases. Totally was about 15 out of the 7 million doses that were delivered. And ultimately, the vaccine, as we predicted, was unpaused and made available. This was all about trying to educate the public and educate physicians on course of treatment, because with these particular blood clots and low platelet counts, standard course of treatment may be problematic in these very rare circumstances. So this was all about educating providers and not about a vaccine being unsafe. And we should look at this as, wow, like even in the very rare circumstance, our system was working and providing this insight to allow us to review data. And so, this tells us the platform is working, the surveillance efforts are working, and we could unpause and be ultra confident that the vaccine was safe. And that's what happened. And I still highly recommend the J&J vaccine. I think it's an amazing tool in our arsenal, and is especially valuable for those that can't take the extra time to take the second dose, that may have whatever concerns they have. Everyone has valid reasons for making their own choices, and this is just this is another option for people. And I absolutely think that people should consider that alongside the other vaccines that are on there.
Yeah, I think it's so important to just emphasize, especially since there's been so much discussion about the regulatory system that many people just are not familiar with, but this is evidence that it's reactive. It responds to signals, it responds to concerns that are raised by providers and even in the data, and it is very reassuring. And I will say, if the FDA review of that data had a different outcome, then the vaccine would not have been unpaused, right? So there was an option to, they were making this decision to analyze this data to determine if it should continue. And because of the data, they determined that it should. It's not that they wouldn't have done it otherwise, because I think there's a lot of misinformation about, oh, there's too much money in the game, or they had to continue it because of, the pandemic. No, they would not have continued the use of a vaccine if it was proven to be unsafe or ineffective. So I would just want to reassure people that it is actually truly reactive to the data signals that we're seeing. Okay, so next question is, folks right now are, like you said, missing second doses, and people are very eager to get to this, fully vaccinated. Now I can start taking my mask off. But can we just remind folks too, what does fully vaccinated even mean?
Right. So fully vaccinated, and this is where there's still a lot of confusion. We had actually a paper in the New England Journal of Medicine that talked about this. There's a lot of confusion about when the timing of protection occurs. According to the existing definitions, it is 2 weeks after your second dose, or in the case of J&J, your first dose. That is when protection sets in, and that is what we will define as fully vaccinated. So as you read these CDC guidelines and make determinations about where you're categorized. If you've had your complete course of vaccine or 2 weeks out, then you can start to do the things that are recommended for those that are vaccinated, which includes sort of gathering outdoors with masks removed, and taking part in activities without masks on with other vaccinated people. I think there's still a lot of confusion, and I think that partly to blame is the scientists and public health professionals that maybe are not doing as good a job as they could to fully explain this, because according to our data, only under half of people fully understood what fully vaccinated means, and 20% of people thought protection happens before the second dose. Over 30% of people were still unsure. So we still need to really inform people, because the last thing we want to do is create people that have changed their behaviors well ahead of the protection, and then ultimately that just keeps this pandemic going further.
Yeah, I mean, let's talk about that too, though, because we saw in the clinical data from the trials that a large percentage of protection was detected after this first dose. And I think a lot of people get tripped up on that. I get asked this literally daily: how much protection do you have after one dose? And I think that that's an incomplete question, because again, you have to think about the trials asking a big question. And the big question is, what is the safety and efficacy for full dosage, which is the 2, right? So even though they were measuring it because it's a data point, they wanted to kind of see what gaps there might be after a single dose. You can't actually guarantee those really, really rich numbers of, north of 90% type of efficacy until you get that second dose and are 2 weeks after. I think that the goal should never be to just get one and get, generally enough. I think that these vaccines are incredibly safe and effective, but it requires being fully dosed. So, just to encourage folks who feel, there's also another concern that people have about the effects of the second dose. And I want to talk a little bit about that, especially folks who've had COVID before and got rocked by dose 1, or folks who've just heard stories about dose 2. I, for one, had a really easy round on dose 2. I consider myself fortunate, and a lot of people are like that too. But let's talk about side effects, what that means for dose 2, what that should tell people about getting it.
Yeah, I mean, listen, I think, it's a reasonable concern that people have about side effects. I think that it is highly variable. Of course, there's some common things like, soreness at the site of injection, or some, fever and malaise, tired. But, in some percentage of people, they experience these symptoms. We have to keep reminding yourself, this is not an infection. This is not something that lasts. This is very temporary, right? These are things that resolve for the most part within 24 hours, 36 hours. These are very quick. And if you can just keep reminding yourself, this is how the vaccine is working. This is how it's generating that immunity. There's no actual illness. And if you can, realize that and just push through, that's probably the best thing. Of course, you can't expect that one person's experience is going to be yours. Everybody will have their own unique experience with the vaccine, but the broad, majority of people are going to have very mild reactions. And I think that you just have to keep, reminding yourself how important this vaccine is. Yes, depending on different timing, if you've had previous infections, some people have had worse for the first or second. It really is highly variable. But ultimately, the best thing is to push through and get that complete complete series of vaccines when it comes to mRNA.
Yeah. So I want to talk about kids, because this, Vaccinate Your Family is very, very committed to encouraging pediatric vaccines and keeping kids on track with their schedules. And it is in the horizon, but the horizon seems kind of uncertain for some folks. And I think now that summer vacation is kind of on the table and schools are around the corner, where we go back to school, a lot of families are wondering, when are kids going to get vaccinated?
Yeah, it's a good question. My expectation is the 12 and over are going to see some level of approval in the next few weeks. That's that's the thought. Who knows when that exactly happens? But in the next month or two, we're going to see vaccines being given to those who are 12 and over, and that will be a decision point for parents. My view is that my expectation is that the safety data will look exactly like in adults. Very safe vaccine to give to kids. And, again, we should remember that there's a couple of reasons why we care deeply about immunizing our kids. One, kids do still represent a large portion of cases. There are still severe consequences for kids. There are many vulnerable kids out there in the population that need their other friends to be vaccinated. And it's also important at a population level around herd immunity, right? If we're aiming for 80% immunity to get to a number that really drives down transmission, we're not going to get there with adults alone, right?
Yeah.
With children representing 20% of the population, we need kids on board with this vaccine. So I personally feel like the parents that have volunteered, the kids and their kids that have agreed to be part of these trials are heroes, and really stepped up to make sure and lead the way, just like all clinical trial volunteers have done so. I'm expecting that we're going to see great data to support increased vaccination, and we should all recognize that this is going to be a path to getting back to normal. And for kids, that is camp. That's going to be normal schooling next year. That's going to be just trying to start removing some of these protocols that they've been amazing to live with, and probably much more easygoing about it than adults, I would say. But let's get to a point where they don't have to deal with some of these things.
Yeah, I completely agree. And I just want to clarify too that we expect Pfizer to be available to kids who are 12 and older, because Pfizer is the one that has had presented at least their preliminary data for that age group 12 to 15. And it, at least in that early data, which was preprint and not the full release, it showed that it was 100% effective in that population, which is just really remarkable. So, and I'll note too that it was the same dose that was given to adults. A lot of people are wondering, how does age de-escalation work for the rest of the population? So there's a lot of kids, a lot of families who have kids that are younger than 12 who are also eager to hop on planes and go see mixed families and see families who are not vaccinated or don't plan to get vaccinated. How, when do we expect vaccines for under 12? And also, how do we manage the intermingling of families with, vaccinated and unvaccinated mixes? It's so complicated. It's so complicated.
Now, the studies for under 12 are well underway. The expectation was that we'll see, the approval at the beginning of next year. I think it could be sooner, depending on when the data comes in. I'm not sure it will be in time for the school year. I think that's still a big question. But yeah, this mixing of families is complicated, right? Because you have families that have to live by slightly different rules depending on who's vaccinated, who's not. Now, it's good that the CDC guidelines sort of extended to people that were unvaccinated around sort of outdoor activities and masking, because it allows to account for kids that can sort of go on a walk with their family, in their household, or see their grandparents and not have to be concerned about masking. But, into some of the more sort of, I would say riskier activities like indoor activities or large gatherings, it still puts a sort of a divide between adults and kids. And that's just obviously something that we want to avoid. For travel too, right? So if we see that vaccine passports are going to come into effect for, say, travel to Europe, well, that's going to put kids at a disadvantage. And so family travel may be problematic for this year, depending on what rules they have for kids. Maybe it'll be a combination of vaccinated parents plus testing in kids to make sure. And this is why the advent of rapid testing and at-home diagnosis can be super valuable to get your kids tested for COVID. But it's going to be complicated, and the CDC does not have an easy job trying to create these guides for all these different edge cases.
I want to add to, I feel like I get a lot of, why didn't the CDC talk about this for travel? Why didn't the CDC talk about this for fully vaccinated people? And I think it's because there are no two family circumstances that are exactly the same, right? So I feel like for myself and my family, we measure our risk, we calculate our risk because in a way that seems a little bit more open to things, because my kids are not in school. So our risk of exposure is just generally very low. We don't see many folks and my kids aren't in school. So it's very kind of tailored per family. Now that said, it's not going to be like this forever. And I will say I have loved being wrong about my timeline for even adults like you and I to get vaccinated. I was on the record multiple times in 2020 saying that I don't think that folks who are kind of in their mid-30s and 40s are going to get vaccinated until probably the fall. So the fact that now we're seeing it's open season, it's been open season for a few weeks. I'm optimistic too that maybe the pediatric population could get vaccinated earlier. But I do think that the younger folks, the absolute youngest, because we have trials for 6 months and older, will probably be among the last to get vaccinated. That probably will bleed over into 2022. Do you agree?
Yeah, absolutely. I think that's likely going to be the timeline. But yes, happy to be fully wrong. I mean, I think some of the data on the 12 and over came sooner than I thought. So who knows what the right thing? But it's better to be somewhat conservative and then see and be wrong in the right direction.
Yeah. Awesome. I kind of want to zoom out a little bit more because
Yep.
it is World Immunization Week, and talk
Yeah.
about vaccine equity as a whole, because right now, we in the United States are seeing some really great trends when it comes to vaccination. At least 50% of adults have had at least one dose. We are getting closer and closer to those herd immunity
Yep.
thresholds, and but we are still in the middle of a pandemic, and a global pandemic requires a global response. And what we're seeing in places like India should be a very sobering reminder that this is not over. We have a lot of work to do. So as Americans, as even people in the United States, what can we do to support the work of vaccine equity and helping countries right now that are dealing with such a huge surge right now?
Yeah, this is a really complicated thing because, obviously a pandemic is a global phenomenon,
Yeah.
and we need to treat our response in that way. If we allow for, the pandemic to go unchecked in other countries, not only is it awful for those populations that are experiencing it, but it also represents a threat to global health because that enables variants to rise in communities and potentially could undo the great work of the vaccines overall.
Yeah.
So we have to take a global lens when it comes to this pandemic. I mean, my view has always been that, we need to think about global surveillance. It's not just about, within our own borders here. And we need to be advocating. We need to be advocating for releasing supplies of vaccines that we have that will never go to use to get those to other countries that need them. I also think that we should look at ourselves as being incredibly lucky and fortunate. And so, I think, yes, it's great that we're incentivizing people to get vaccinated in this country with $100 check or shots for shots or free beers or whatever it is. But, I think hopefully people take a step back and recognize the advantage position we're in.
Yes.
That vaccine is available to you, get it, because, it's not, there are people around this globe that would literally do anything to access this vaccine. So you getting vaccinated helps the global equity, but also advocating for making sure that we don't hoard vaccine is super important. And I think, that is something that we should all be on board with.
Yeah, that's perfect. The perfect way to kind of tie everything up. I feel like one thing that I've been constantly saying to my followers is that every single dose brings us one step closer, right? Mm-hmm. It's a collective effort. I mean, think about the origins of this pandemic. The pandemic did not originate here, right? And it's how we are all tied. Viruses don't care about national borders. They don't care about where people are. They will just find bodies to infect, which is why we need to be continuing to stay vigilant, to keep transmission low, to keep vaccinations high. We are getting closer to the end, but if we start to lose kind of our momentum, we can see the kinds of things that are happening in other parts of the world. So that's why we are still wearing masks. We are still being as risk averse as possible, because the end is in sight, right? At least for some places. And we don't want to lapse on that.
Great. Absolutely. I think that we have to do our part, again, like this vaccine wall that we're hitting. I really just hope that we can, with, this immunization week, we can explain to people how important vaccines are, both for COVID, but also more broadly. I mean, unfortunately, like this week doesn't get a lot of attention normally. We push on flu shots and other vaccines, and hopefully this is shedding a light on how like vaccines are such a weapon to combating emerging infectious diseases. We're lucky that we don't have to deal with infectious diseases in the ways that we once did because of vaccines. So, this is a moment for us to really, embrace these incredible scientific achievements.
Yes, absolutely. And we've seen some data that have shown that, the pediatric population has been a little bit lagging on their scheduled vaccines, in part due to the COVID-19 pandemic. But we're hoping that we'll see that those, those well-checked visits will start coming back online, and that folks can take their children in to be back on track, especially in advance of the school year. The last thing we want to see is a resurgence of measles outbreaks in the fall while we're still dealing with a pandemic. So, just be mindful of that. Make sure that kids are still up to date on their vaccines. I think this was a perfect way to kind of tie everything together, John. Anybody who's following, we'll save this live on the Vaccinate Your Family page. And just know that John and I will continue to be resources to answer any questions about the vaccine, about the pandemic. And we're very thankful for all of you joining us. Thank you to Vaccinate Your Family for hosting this. And we'll see you on Instagram.
Thanks so much. Good to see you.
Thanks, John.
All right. Bye.
Bye.